based on your experience, like you talk about the root cause of diabetes, and what is the main driver for diabetes in India? Is it carbohydrates? Is it energy toxicity? Or is it visceral fat? Or is it genetics? There are so many reasons, but what are the top reasons in your mind as a root cause?
The top reason is 70% of the cases it is diet.
Diet.
Okay, 70% cases. In remaining 30% cases, it could be your lack of activity, it could be a stress, it could be some strong family association, and sometimes even the pollution and other things. But 70% what is causing the type 2 diabetes epidemic is the high carb diet people are eating across India, especially more so with the vegetarians, because hardly 25% vegetarians are eating proper proteins.
Right.
Otherwise, vegetarians are more protein deficient, having a protein deficient than non-vegetarians. Even non-vegetarians also not eating the diet properly. For example, when I see the patients, most non-vegetarians eat non-veg only weekly, twice or thrice. Rest all the meals they're eating again high carb diet only. And also non-veg also, they think that eating biryani, eating non-veg curry with rice, chapatis, again they'll indulge carbs along with their proteins. It is diet, eating high carb diet and processed foods is the major cause of diabetes epidemic in India.
Absolutely.
Right. So, is it right to say that because of lack of protein, we are eating more carbs?
That is also one of the reason, because, for example, if you are if you know how to optimize fiber and protein in your meal, automatically your intake of carbs will reduce.
Right, right.
For example, I tried this. For my patient, I practically advise these things. I'll tell them that you forget about all this low carb, keto, and all those things. I will tell about the body physiology. Your body need a fiber. Your body need a protein as per your body weight, at least 1 gram per kg body weight. And your body also need a carbs, but not in the refined form, at least unrefined forms. I tell them you follow this order. First, eat a fiber, at least 50-gram fiber in the form of simple salad or sprouts. Then eat your protein, 25-30 gram protein as per your body weight. At the last, keep your carbs. That carbs, instead of white rice, replace with red rice. Minimize it. Automatically, I found that once they start a meal with a fiber and protein, their intake of carbs will reduce,
Right.
because they are 50% full with the fiber and protein only. And in the dinner, I tell them, if you're in the dinner and all, where you're not working at all, you eat only fiber and protein. No need to eat any carbs at all. If you're serious about reversing the diabetes and reducing the weight, eat your carb only for 1 meal a day. Other 2 meals, eat only fiber and protein.
Right. So, one common pattern which we see with people is that Indians are not very fat, not obese. They are skinny fat or tofu as we call them. Uh, but in spite of that, we tend to get diabetes. What is the reason behind that?
See, that could be one thing is Indians, and I do not think agree with you completely. See, I might just give an example. You see your marriage photograph of your parents' age, 30, 40
Mhm.
years.
Mhm.
In the entire photograph, you hardly see one or two people obese.
Mhm.
You see today's marriage photographs, you see 50% people are obese.
Right.
In addition to that, there are thin individuals who are diabetic because they have a lot of visceral fat.
Mhm.
What happens in this gym culture is not there in the India, especially
Mhm.
somebody who are aged 50 plus now. They think that gym is not for us. The weight training is only for young people. 50 plus people in India think that they're only meant for a walking. If they go to gym, they'll have some injuries and all. The concept is not there. Automatically, after 30 years, they start losing the muscle mass. And once you lose the muscle mass, your tummy fat will start increasing.
Mhm.
So both the ways, even obese becoming diabetic and thin individual with a visceral fat also becoming diabetic, both are true.